Hmm. Hi everyone.
Hi everyone.
Today is going to be a little bit more serious. We're talking about a case study. Um, so the information can be more technical, and it's it's going to be more for the practitioner or who has more interest in TCM to understand what I'm talking about. But just listen in and then see if this is something that you're experiencing, and maybe I'll be able to help you with that. So our case study patient is a female, about 47 years old. She has been my patient for a while, and she's like, if you look at her, she's you can tell that she's usually cold, and her hands and feet are very, very cold, and she has, you can tell she's a little bit, her face is a little bit puffy, her limbs are a little bit swollen. Um, the technical term is called edema. So basically, it's water retention under your skin or in your muscle tissues. So I have seen her a couple of times already, and then she's been taking the herbal medicine to basically to warm up her body too. So her body is lacking of heat, so I gave her the herbs to warm up her body, so like her hands and feet can be a little bit warmer. And also, once your body has more energy, this heat type of energy, the water metabolism can be better. So imagine if you're trying to, there's a water kind of pools under the floor. You want to get rid of it is by just heating up the room, and so it will evaporate. And that's basically how you get rid of water in the body. You cannot just take a mop and mop it off, right? So that's how it works, and she had previously a bit of a constipation issue, that she's not able to have a bowel movement for for 5-6 days unless she takes any laxative. So she has been okay after a couple months of herbal medicine, and now she only needs to take like the fiber pills every other day or every day, I forgot. And she's able to have a normal bowel movement now. But she still has a lot of issue, because when I ask her how often she has to pee, she says like she only pees 3 times a day. And in the morning she goes to work, and she doesn't even need to pee until she goes home. So like for 8 hours, she still drinks water normally. Like every day she drinks about 5 cups of water, but she just doesn't pee. So this water goes in and it has to go out, right? But it doesn't go out. So it's accumulating in the skin and then in the muscles. That's why. So the water metabolism is really bad. So everything our body needs metabolism. So you need new things going in, old things going out, right? So that's a healthy cycle. If there's only if something only goes in and it doesn't go out, then there's something wrong, right? Or if nothing goes in and then everything comes out, there's something seriously wrong. So in order to achieve a healthy balance of your body, healthy metabolism, you have to have in and out. So, right, make sense?
Totally.
So every morning, like when she wakes up, her face is a little bit puffy, and she says the eye bags under her eyes is a little bit puffy too. And it's because of the water that she's drinking, but it's not coming out of her body, right? but her major issue, the reason that she came back to me again, is because she has sleeping problems. She couldn't sleep for like more than 5 hours every day for the past 2-3 months. She's not able to sleep before 2 a.m. and then she wakes up exactly at 6:55 a.m. and she's not able to go back to sleep anymore. So 5 hours of sleep every day for 2-3 months, it's very, very draining for her body, and she's very tired, and eventually she started to have some dizziness in the afternoon around like 3-4 p.m. So after I kind of checked her, go through all these symptoms that she's having and checked her pulse and tongue, I kind of, the idea that I had, the formula that I had in mind to prescribe her is something similar to what she had been taking, and I thought she stopped taking it for a while. That's why this problem came back. But then she told me like she's been taking the herbal medicine every day and kind of religiously doing that. So that gave me a feedback so I know that the herbal medicine I gave her is not addressing this new issue that she's having. So maybe it's not, the formula I gave her worked for her, but it's not like a good compatibility with her. It's not very compatible with her body type. So then I did another step that I've been incorporating in the last 6 months, is to check her tummy, check her abdomen. So after I checked her abdomen, I found that she has a lot of pain under her ribs. So when you can feel the ribs end up around here. And when I kind of press under the rib, she has a lot of pain on both sides. So this indicates that there is a problem with the liver or gallbladder or a system we call sanjiao. It's basically like a water passage in our body. So this is completely like a new information that I didn't have before. And this just completely changed the formula that I was going to give her. And for the longest time, her stomach area, so this is the rib, and just in the center of the rib, this is where we check for the stomach. And when I put my hands on her skin, it's very cold. It's very cold to touch compared to other areas. So this tells me that her stomach is very cold. The temperature in her stomach is much, much lower than her body temperature. That means her stomach isn't working, because when the temperature is low, the metabolism is low, it kind of, basically the stomach goes into hibernation. It's sleeping, it's not working. So that's why she has a very little appetite. Like she eats like 2-3 mouthful, and then she will feel like she's done eating. She cannot eat anymore. And every day she eats very little, like maybe 1.5 meals, and each meal is like very little. And I thought the formula I gave her before addressed that problem, but apparently it didn't improve at all. So it again tells me that the formula I gave her wasn't completely compatible with her body type. So it kind of I started looking deeper, and then in the beginning she didn't tell me about the dizziness that she has until I further kind of investigated, and then she said and she started feeling some dizziness in the afternoon. So in Chinese medicine, let's say in Western medicine, when you have dizziness, they'll tell you the fluid in your ears is imbalanced. That's why you feel dizzy, like you're on a boat, you couldn't balance yourself. But in Chinese medicine, I'm gonna make a diagram. So this is really bad diagram.
This is the time we need a cat to entertain people. All our cats are sleeping upstairs. No one wants to come downstairs today.
So I don't know if you can see this. Okay. So this is
Let me hold it.
the head.
Hold it.
Is it blurry? Can you see? Okay,
Let's see.
good.
Yeah, that's okay.
So that's the head. That's where the ear is. And then this is where the ribs are. So in Chinese medicine, the ears, the imbalance of the ear fluid in the ear is due to because of water accumulation in this rib area. And that's, if you look at the diagram, it's basically a balance. And the base is around where the ribs is. So when you have a scale, have a balance, and the base is kind of floating on water, of course the top where the ears are is gonna go like this. So based on these few things, so remember last episode when I talked about Chai Hu, when there is like ribs pain and then distension or discomfort around the ribs, under the ribs, you need the herbal medicine Chai Hu. So in this case, I used Xiao Chai Hu Tang, which is the like a basic tonifying formula for when people have this ribs distension type of issue, plus another formula called Ling Gui Zhu Gan Tang. So it's basically it has Fu Ling, which is improving the water metabolism. Two is Gui Zhi, which is the cinnamon branches, is supposed to improve your heart function. And then Bai Zhu, which is a herb to when you have like swollen limbs and digestive issues, that's when I use it. So because when I checked her stomach area, it's not only cold, I can feel the heartbeat. When I press down, I can feel like the heartbeat is very strong like this. It's called palpitation. So when you see this type of issue, Fu Ling and Gui Zhi are very important herbs. And when I narrow down to 3 herbs, Chai Hu, Fu Ling, and Gui Zhi, and then I go into then I go select a formula that contains these 3 herbs, also that treats dizziness. So that's how I came up with this formula. And after I gave her these 2 formulas, she said she took them about 2 days or 3 days. She was able to sleep throughout the night, and then it's just all of a sudden she can sleep now. So she was very surprised at how fast it worked. And the thing with Chinese medicine, you have to really find the right formula to target the body, target the issues. So when you find the right, correct formula, it'll work very quickly. But there is a process until we find this formula, because I've seen her so many times and I know her for a while. That's why I was able to narrow it down so quickly. But before this time, I gave her a formula that kind of helped her, but didn't completely kind of hit the bullseye. So that's why she was better, but not completely better.
I have a question. But when you check her abdomen, is there any way we can examine ourselves at home before knowing that there's a problem? Because not everybody will regularly go seek for TCM.
Yeah, so
So, for example, which areas, or if we can have our partner just exam for us?
Generally, you want someone else to check it for you, because when you're pressing yourself, you don't feel anything. You don't know, because you're trying to tickle yourself. You're not ticklish, right? So when someone touches you, they can really tickle you. So, right?
So yeah.
I'm gonna make a diagram of the abdomen. So this is where the ribs are, and that's your belly button. These are your legs. When I check for under the ribs, I'm checking these areas, these two areas. So what I do is I use the thumb, so kind of press inward slowly, and if you feel like a resistance, or when you press to certain deep and the muscle just kind of tense up, pushes up, that means there is a problem with your ribs already. Or if somebody doesn't have any issue, it's very soft. When you touch it, it's soft. You can press it just like you press like your legs or like any soft tissue. The patient doesn't feel anything, doesn't feel pressure. Or a good tip to check is that you can touch another part of the abdomen. Maybe let's say generally like this area or this area. They don't have, like, find a soft area. Compare this area to this area. So you can feel like, okay, there's no resistance here, and you compare it here, you can feel more, it's easier to distinguish the feeling of these two areas. So generally, most people have issue with the right side. I know this is mirrored, so your right side is, anyway, you know where right side is. The hand
there.
that you the hand that you wipe your ass. Okay. So most people have issue with the right side, but sometimes we will see people who have issue with the left side only, or both sides. So that's where you check for liver or gallbladder issues. So people who have pain or distension or swelling or resistance here, that it's there's an issue here. And the next part is you can check this is the stomach area, so where I circle. So between the joint of the rib up to your belly button, that's the stomach area. So you can start from pushing with 3 fingers and just kind of gently push down. And if you feel pain along any of these areas, so that means the digestion can be some issue. Or when you press deeper, like I said, this patient, when I press deep, I can feel like the heartbeat, like boom, boom, boom. So that usually means there is there's a water issue, and also the heart probably isn't strong enough to kind of disperse the water in this area. Sometimes you feel the heartbeat around the umbilicus. It can be just different areas here, because there is a artery that goes down and branches to the legs. So what are you feeling is this artery beating. And because for a healthy person, there isn't too much water accumulation between the artery and the skin. So when you press down, you don't feel the artery, or only when you press very deep, you can feel a very little heartbeat. But if there is a water issue, you can feel like the heartbeat is like very, very pronounced. And the next part is you can check if you're passing the stools completely. What you do is on both sides of the umbilicus, your belly button, about 3 finger wide. This is where we check for your bowel movement, how healthy it is. If it's soft, it doesn't hurt, or you don't feel like sometimes you'll feel like a string of muscle there, very tense. It can also indicate there's issue with your bowel movement. So these are a few things that I check. Normally I check the whole abdomen. There's also things that happen with lower abdomen. With lower abdomen, it usually indicates for women it can be menstrual issues or urination issues. Urination issues are more common with men. Menstrual issues are more common with women, of course.
And how about the temperature?
You
mentioned that you could feel it's cold. So which area was it?
Make sure your hands are warm, and what you do is just kind of touch everything in the abdomen. So what I do is put my hands on for like 3 seconds. Just make sure our temperature kind of become the same, and we can feel around the different areas. See if you can feel any temperature difference. Sometimes it can be hotter, sometimes it can be colder. It's case dependent. So it's kind of hard to. I can do another video to kind of teach you how to do all these checkings, examinations. So anything jumps out, like when you touch it, oh, it's so cold. It's compared to this area, it's colder, or compared to this area, it's hotter. So you get a general. First, you get a general idea of what the overall temperature is, and then you can feel like different areas. It can be hot, it can be cold.
Because the reason why I ask about this is a friend of mine. I think she's pretty fit already, but I think might have been a little bit overworked out because she's into exercise. I think she's very fit, but she kept complaining that she just couldn't lose her fat around her belly. And by the look at her face and I know of her, I think she must be a cold person. Is it possible that she is not hot enough? So no matter how hard she tried to work out, there's always that the fat around her tummy is just it's going to stay there because her body just keep telling her that I need to retain some heat or fat or else I cannot sustain the whole body. Is that possible?
Yeah, of course. Like when you look at animals, animals in the colder region, like polar bear, penguins, sea lions, seals, they all have like really fat layers under the skin because they need to. The fat helps them keep the body temperature at a certain level. So when your abdomen is cold, like inside the intestines or the stomach is cold, your body is trying to protect it by keeping fat there. So also when you're burning fat, when you say burning, you need heat, right? So the best way to do is kind of warm up from the inside. So taking herbs or using the moxibustion, so to warm up the area, that might help with her her fat.
So for someone who has hit a plateau and then just couldn't get rid of that belly fat, perhaps they should consider seeing a TCM to make sure that their body is in the right balance then, or else their belly fat is just going to keep staying there no matter how hard they try to.
Yeah, and another thing with workout is that you can overwork. Like when you So our body needs to stay in balance, right? Make another diagram.
Oh, hey, mom's watching. Hey, mom and
Hi,
Ruth.
Mama.
And
Hi, Ruth. So that's a simple diagram. This is 0, that's the center, neutral, this is plus and minus. So when your body has a lot of junk, a lot of fat or toxins, you need to work out and be on a diet or until you're reaching this point. But when you reach this point and you're still doing whatever you're doing here, you're gonna end up here. You become weak and deficient, and whatever you do, you're no longer losing weight. You might actually end up hurting yourself by doing what you were doing. So it's very important that when you reach this point, or when your body reaches like a neutral point, you need to kind of change up what you're doing, and don't overwork yourself, because when you overwork yourself, your body's gonna be weak and deficient. It's not gonna help you get stronger, get more energy, or help you lose any fat.
Got it.
Okay.
Yes.
Thanks for watching, and we'll see you next week.
And stay tuned for the Mandarin version then. Bye bye.